Hey everyone, it's Dr. John Burroughs at Springs Aesthetics. We're in one of our operating suites. I wanted to discuss today the MyEllevate neck suspension lift. It's very interesting and we've been getting great results from it. It was developed by a Beverly Hills plastic surgeon, and basically it uses a 2-0 suture thread weaved almost like in a canopy or web-like fashion across this area here. And it holds and is anchored in place by the fascia behind the ear, which has a lot of strength to it to anchor it. So it works really well to drape loose skin. If you have the turkey gobble, it's going to pull that back up. And if you have those vertical bands here, kind of like that, I know I look silly doing that, you can release those with this, all without surgery, which is pretty neat because the suture does a lot of the work for you. And the pattern developed by Dr. Mueller in Beverly Hills is very amazing. So I just wanted to show, this is our model, Goldie. So she has a nice aesthetic neck chin profile. This is called the cervicomental angle. But as we get older, we start to develop, the neck fat. Some patients call that neck chub. And you also, even if you don't have a lot of fat there, the skin gets loose. So if you've had a lot of weight loss, been taking good care of yourself, our facial tissues start to sag more because we don't have the fat underneath to support it. So the MyEllevate suture lift, you use a special lighted rod here, and it goes in this pattern, and there's 8 holes that you go back and forth with, and you do it just below, about 1 centimeter below the jawline there, and it weaves through. The suture is attached in the middle here, and it weaves back and forth so that it goes all the way across, and then you tie here in the center area. And because it's anchored right here behind the earlobes there, it's going to hold really well. Results can be as long as 5 years, and that's again without surgery. So when a patient comes in to get this done, they're usually doing a few other procedures with it, but it can work by itself quite well for just sagging tissue. But if there's the fat underneath the neck in that submental area, we can do liposuction to take some of that out at the same time. And this is a liposuction cannula I like to use for necks. And basically you just do a small little hole underneath here and you can pull out that fat. And then once you've done that, you can further tighten the skin before you do the MyEllevate by using our neck tight handpiece. And this is something that doesn't elevate quite right away, but you come in from the sides here and it'll tighten the skin tissues, and it can further, if you crank up the energy, reduce even more fat that then gets absorbed and is gone. Now you might ask, why would we do the energy approach with the suture MyEllevate approach? Well, the reason we do that is because it gives skin quality improvements as well. And there's certain areas where you may not want to liposuction as much, or there's areas where you don't need to liposuction in the neck as much. So we often do those all as a combination. And then lastly, with the procedure, you can do the Morpheus radiofrequency. And I don't know if this is showing up well on our camera, but basically these little needles come out. They're attached to the handpiece here, and it's automated, but you have to hold it and apply it in the areas you want. But it's very customizable. So you can turn up the energy in areas where you have more fat or you need to tighten more, and you can reduce the energy in other areas. And this also improves the skin quality. It stimulates collagen and elastin production, which just further helps enhance everything, because the MyEllevate suspension lift, it's going to re-drape things up, but it doesn't tighten. So between the Morpheus radiofrequency needle treatments and the neck tight, you're going to get a really nice result. So what does it look like? Basically, as I mentioned, there's 8 little small holes. Once you've made those little holes, you undermine them with this little rotation device, so that helps you create the space that you can pass your lighted rod through and be sure you're in the right plane. It also is attached, I don't have it with me right now, to an LED light source, so that underneath the skin you can tell if you're too close to the skin surface or too deep. So that keeps you from going into the muscle underneath. That could cause some issues, and it keeps you from being too close to the surface where it perhaps could remain with a tension band that you don't want, or that it could perhaps erode out of the skin at some point. So it really gets you in the right plane, which is outstanding because it's important. Once you've done that, like I mentioned, you tie it in the center area. And the nice thing about this approach is you see that tightening result right away. Now, for the first couple of weeks, it'll be a little tight, almost like suspenders under the skin, but that smooths out as you're getting through that second and third week. There's really minimal downtime with this. For the first couple of weeks, we have patients wear a seat collar around their neck so that if they're reading or on their phones, it keeps them from bending their neck, and that just helps it situate in there the best way possible. After that, they also, during that time, just sleep with the support garment around their neck and lower face at night for a couple months. It's not a big deal. And typically, you're really looking great within a couple of weeks, but you can go about and work and do things after even just a couple of days. And other than the suture material underneath to hold the MyEllevate in place, you don't need to close the incisions. They're just little small puncture sites, and they heal up all on their own. So I just wanted to share how that kind of looks. We do that with patients awake, and they get a little relaxation. Some of them, they don't want a lot of sedation. So when we're starting the case, you can get some laughing gas. It's a mixture of the nitrous oxide and oxygen. Breathe that 8 to 10 breaths. And what that provides is a level of relaxation until when we're numbing the tissues in the area, that it's quite comfortable. And we use a local anesthetic that's diluted down. It's called tumescent anesthesia, and you infiltrate quite a bit to kind of balloon the tissues up, and that helps make the procedure not only comfortable, but it makes it better as you're doing it to stay in good planes. So I hope that was helpful. We have had very great success with this, and one of the earliest in Colorado to start doing this. And the thing that I like about it is that it's quick, there's minimal downtime, and it's non-surgical, but it gives you pretty darn close to a surgical result. Sometimes it does give you a surgical result without having to have big incisions along the hairline behind the ears, or a Z-plasty, other things in the front area. So I hope you found it interesting, and thanks for watching.